And thank you all for joining us for our first EU exit and post-transition guidance webinar. Today's aim is to provide guidance for manufacturers of biological medicines for independent batch release in the UK from the 1st of January 2021. And our speaker today is Silke Scheppelman. So I'll hand you over to Silke.
Okay, hello everyone. My name is Silke Scheppelman. From me too, a very warm welcome to today's webinar. This is the first of a series of MHRA webinars that are going to take place this month. I'm now going to turn my camera back off again to reduce bandwidth and the risk of people experiencing poor connectivity. Give me a second. So this webinar is run by NIPS, that's the National Institute for Biological Standards and Control, with the support from our colleagues at the MHRA. Now, NIPS is a center of the MHRA, and we, oops, hold on a second. So, and we are the UK's National Control Laboratory for Biological Medicine. So these include immunologicals, such as vaccines, and also products made from human blood or plasma products, including plasma pools. So today we're going to talk about independent batch release by NIBSC. And just to set the scene, this is not to be confused with the batch testing or QP, QC testing carried out by manufacturers. And today we're going to update you on the arrangements for the time after the end of the transition period to help you prepare. Okay. I'm trying to get the next slide up. Oh, apologies.
I'm sorry, Silke, if you can please click on the PowerPoint first.
Thank you very much. As I said, this is the first one in the series of webinars, so forgive us for these little hiccups. I'm starting off with a generic slide I've been asked to show, so I'm leaving it up for a moment to give you time to read it. Okay, so thank you for joining. The timings, we expect this presentation to take about 20 to 30 minutes. This will be followed by a questions and answer session. We expect that the entire webinar will last around 1 hour. We will only cover guidance that has been approved and is current as of today. The webinar is being recorded, and a link will be sent out to delegates once it is available. Now, the recording will not include the Q&A session because both the guidance and the related questions and the answers may still be subject to change. Okay. Some of you have pre-submitted questions as part of your registration to the webinar, and we have grouped these and we will answer them first. And then we will work to answer questions that have been submitted to us today during the seminar. If by the end of the webinar you still have a question that has not been answered, you can get in touch with us via our customer service centers, and the contact details are shown here at the bottom of the slide, or you can contact your trade associations. I will show these details again a bit later. Now, starting with some background on the preparation of the guidance we are presenting today. This guidance is targeted at manufacturers of biological medicines and wholesalers to help you get ready for the end of the transition period. Until then, the independent testing of batches for the UK will be carried out as usual via the EU's Official Control Authority Batch Release System, OCABA system, within the OCABA network. This system involves independent testing and certification of all batches of biological medicines. OCABA is performed by this network of specialized national control laboratories, which form the OCABA network. NIPS is a member of this network, and the work is shared, and decisions and batch certificates are mutually accepted by all member states on the basis of this EU directive here. However, from January, Great Britain will no longer be subject to this legislation if no agreement has been reached with the OCABA network by then. So this webinar today sets out what will happen in that situation only if no other arrangements are in place. In this situation, NIPS will be a standalone national control laboratory, and we will remain a member of the wider network of European official medicines control laboratories, or OMCLs. This network is called the General OMCL Network, as this sits under the Council of Europe. But we will no longer be a full member of the OCABA network, as we are at the moment. So we will no longer automatically recognize OCABA certificates. Instead, NIPS will issue our own national batch release certificates. Manufacturers and wholesalers will need to consider different regulatory scenarios when marketing batches in Great Britain and Northern Ireland. Great Britain includes Scotland, Wales, and England. The guidance we prepared for Great Britain will probably look familiar to many of you, as we essentially repurposed the guidance we previously published in preparation for no deal, whilst Northern Ireland will operate to the EU regulatory system under the so-called Northern Ireland Protocol. We published our last guidance update on the 1st of September on the NIPS website. We also had a de-snagging meeting with industry trade associations on the 14th, and we will publish further information very soon. Possibly today if it has not been published yet, and this will appear on our NIPS website. So starting with Great Britain first, from January, NIPS will certificate all batches of biological medicines for Great Britain. Okay, this will apply to most batches before they can be placed onto the market. The exceptions are batches that have an EU OCABA certificate that was issued on or before the 31st of December this year, or batches that were manufactured and certified by a country with whom the UK has a relevant mutual recognition agreement, an MRA. Now, the UK will have an MRA in place to cover batches manufactured, released in Switzerland or Israel initially. The regime for issuing a national certificate will include NIPS applying a public health risk-based approach to decide whether to carry out laboratory testing of a batch. For a fixed period, this will include taking into account OCABA certificates issued by OCABA laboratories after the 31st of December, as these will have been issued based on OCABA guidelines we already agreed to. We are asking manufacturers to submit samples of relevant batches and documentation as early as possible. By documentation, we mean your protocol. You will already be familiar with this if your product is currently undergoing the OCABA process. If you have OCABA certification for a batch, please also submit it as soon as you have it. Information about NIPS's turnaround times for batch release can be found on our website, and there you can see that they're generally well below the legally required 60 days, and we intend to continue to meet our current turnaround times. We will continue to offer parallel testing at the same time as manufacturers perform their QC testing, and this will help to meet release dates and it will require manufacturers to submit samples ahead of the final documentation. This is not different to the current process for Okaba batch release. Manufacturers must inform MHRA and NIPS of the intention to place batches of biological medicines on the market in Great Britain at least 7 days in advance. They must send a UK marketing information form together with copies of the relevant certificate to this email address given here, which is the same as the one we currently use for our marketing information forms. The new UK marketing information form will look very similar to the one you currently use for Okaba. The main differences are highlighted here on the left. We will ask you to specify which market your batch is destined for, Great Britain, Northern Ireland, or both. There will also be new statutory fees for Great Britain, although I need to stress at this point that these will only apply if the relevant bill passes and becomes law. The fees in that case will then broadly be the same as the current fees we charge in our role as the UK's Okaba laboratory. I leave this up for a moment for you to have a look. And we're then moving on to the process for batches that are destined for the market in Northern Ireland. So here we will continue to accept EU Okaba certificates without further testing. If no Okaba certificate is available, you will need a certificate from NIPS. Okay. As at present, you must provide us with a marketing information form and a copy of the relevant certificate at least 7 days prior to placing a batch on the market in Northern Ireland. If a batch of a product with a UK marketing authorization is placed on both the Great Britain and Northern Ireland markets, it will need a NIPS certificate for Great Britain and an Okaba certificate for Northern Ireland. Okay, now moving on to some special situations. Manufacturers and wholesale dealers in Great Britain that import biological medicines from Northern Ireland or the EU EEA will be required to check that each batch has an appropriate NIPS or a mutual recognition agreement certificate before they can place the market on before they can place the batch on the market in Great Britain or supplying another authorized person in Great Britain. This could, for example, be a hospital. Okay. This information can be obtained from the product's marketing authorization holder. We have published guidance on the responsibilities of wholesalers importing medicines into Great Britain and also about the new role of the responsible person for import, so the RPI, if you would like to find out more about this aspect. Batches placed on the market in Great Britain under a parallel import license will also require a NIPS certificate, and the guidance for batches for Great Britain will apply as I discussed previously. That includes a requirement to provide a UK marketing information form and NIPS certificate in advance of the product being placed onto the market. I'm not going into more detail here now, but further guidance on this subject is also available. So finally, there are a few points I would like to highlight in this webinar. First, NIPS will continue to test and certificate batches destined for so-called rest of the world non-EU countries. We will also continue to test batches for the WHO pre-qualification program. And as a member of the European OMCL network, as I said at the beginning of the presentation, we will remain a member of the GEON. We can continue to offer batch release testing for Europe in liaison with the European OMCL, and this can be done via subcontract arrangement. I would encourage you to get in touch with us if you are interested in this approach. So to summarize, this is what manufacturers and wholesalers will need to consider from January when marketing batches in the UK. Are the batches destined for Great Britain or Northern Ireland or both? Do you need to submit samples of the batch for parallel testing at NIPS? Remember to send the UK your manufacturer's protocol and the UK marketing information form together where required with the relevant certificates. Okay. Now, if you intend to market biological medicines in the UK next year and you are not already talking to us, or if you just need further clarification on specific points, please contact us as soon as possible on this website, on this email address here, cbb@nips.org. CPB stands for the Control Program Board. And also, as I said in the beginning, there are also the contact details for our customer service center, or you can alternatively get in touch via your trade associations.